So our next speaker today is Karli Keator. Karli is the Vice President of Policy Research Associates, which is a New York-based organization that provides national technical assistance, training, and policy analysis on topics related to behavioral health. She also serves as the director of the National Center for Youth Opportunity and Justice, where she leads all youth behavioral health, trauma, and juvenile justice research and policy initiatives. Ms. Keator has conducted numerous research studies and evaluations in juvenile justice, including on collaborative approaches to improve school safety, breaking the school-to-prison pipeline, trauma-informed protocols for juvenile justice practitioners, and evidence-based screening tools. She's also provided technical assistance and training on diversion policies and programs for justice-involved youth with co-occurring mental and substance use disorders. And her projects have also been funded by federal agencies such as the Office of Juvenile Justice and Delinquency Prevention and private foundations, including the John D. and Catherine T. MacArthur Foundation. And she has her Master's of Public Health with a focus on social behavior and community health. And so when I asked her how she became interested in this work, she talked about her days in high school in Woodstock, New York. Yes, the Woodstock. And despite a small graduating class of about 90, she said that by the time she graduated, she had about a dozen friends who had spent time in jail and prison. And she said that everybody knew these kids, and they all knew that these kids were struggling, like her friend who was in foster care and received a jail sentence during high school, and too many other kids who committed suicide or who died in drunk driving accidents. And she realized that the world was failing them, that they were not failing the world. So she said her inner sense of justice kicked in, and she was lucky enough to join an organization in upstate New York that is doing great work on these issues. So very appropriately, her presentation today will cover disrupting school justice pathways for youth with behavioral health needs. Thank you.
Good morning. Hearing that introduction, who says high school doesn't live forever? So thank you so much to the questions after Ed's presentation, because that cues up, I think, so well what I'm here to talk about today, which is really thinking about those upstream interventions. How can we identify those kids where there potentially is an opportunity for keeping them out of the justice system because they are lower risk? Wonderful. So as Ed did talk about, the relationship between mental health, substance use, and traumatic exposure and juvenile offending is very complex, and it's not causal. But what we do know is that there's an incredible overrepresentation of kids with these conditions who are in the juvenile justice system. And what we do know is that, in particular on the front end, so for kids who are not those those serious offenders, but for kids who are, on community supervision or in the on probation, or having contact with the system and being diverted, that those low-risk kids, that there are really incredible opportunities to continue to change their trajectories. We also know that there are incredible consequences of unmet need. So by not addressing the mental health needs, substance use needs, or really addressing the traumatic stress that these kids are experiencing, there's an often rapid and steady decline in mental health. You'll see increased substance use and abuse, increased risk for suicide, increased risk and challenges in school, at home, or in the community, or at work, and this is what we're going to be talking more about. Increased risk for homelessness, increased risk for victimization. We also know that a lot of kids who need behavioral health services are not actually engaged in behavioral health services. So if there's one takeaway from today, this is it. So what do we know about the relationship between youth with behavioral health needs and school justice pathways? We know that students with disabilities are twice as likely to receive an out-of-school suspension when compared with those who do not have disabilities. And we know that students who are suspended or expelled from school are 3 times as likely to be in contact with the juvenile justice system in the next 12 months compared to their peers. Just let that sink in for a minute. So what this means is if we can keep kids, or theoretically means, is if we can keep kids in school, if we can provide those therapeutic interventions and supports that they need to engage in some of those pro-social activities, to stay in school, to stay in their community, to stay home, that we are likely to be able to divert them from future justice system contact. This is another way of looking at this. So we know that students with IEPs make up about 12% of the population. These are national data, but youth with IEPs make up about 12% of the school population, and yet they make up 25% of students who are arrested on campus. So I'm going to talk about one example of a model for diverting kids from the school justice pathway in a school-based setting. This is the school responder model. It is not the only work that's being done in this area. In fact, Evan is engaged in a lot of this work as well. I know he'll be talking about something else today, but there are a number of models or a number of groups that are really doing some incredible work here who have some data to show that there really are opportunities in the school setting to divert kids from the juvenile justice system. So the school responder model came out of work that was funded by the John D. and Catherine T. MacArthur Foundation. From 2007 to 2011, there were 8 states that are listed right up here that really were focused on this whole notion of how do we better meet the needs of kids who have mental health conditions, in particular kids who are coming into contact with the juvenile justice system. And over a period of a year, they decided that there were 3 areas that they really wanted to focus on. The first was, how can we keep kids who don't need to be in the system out of the system? The second was, how can we increase family engagement in these processes? And the third was workforce development. So how can we better inform not just the juvenile justice system workforce, but all child-serving systems and that workforce around these critical issues? In terms of keeping kids out of the juvenile justice system, so that whole diversion work group that formed across these 8 states, they focused on the furthest upstream opportunities. So school-based diversion, law enforcement diversion, and intake diversion. And this school responder model work came out of the work of these 8 states. The 2 states who have been the most, I think, expansive and have the most data in terms of their school-based diversion work are Connecticut and Ohio. And I'll share some of their outcomes in a minute. After 2012, so after this model, the school responder model, had been piloted, there have been some evaluations done of it. It has then since been expanded into communities and a number of other states. You'll see that Wisconsin is on the list here. There are challenges that we will talk about in terms of how this model has been replicated in other states. And not all of these states have been successful in implementing all of the aspects of a school responder model in their communities for various reasons. So what is the school responder model? A school responder model is really an alternative response, right? So if we're talking about diverting kids out of the juvenile justice system, you know, or most schools know, that if there's a kid who's acting out, if they call the police are going to show up and they're going to handle it. So if we want to have an alternative response to kids who have a behavioral health condition, we have to give schools tools or an alternative to call. So they have to have somebody else that they know that they can call and get a response. It helps schools and communities identify who these kids are, connects those youth and families to services both in the schools and in the communities, and through therapeutic interventions, restores the youth to a place where they can engage in the school while maintaining school safety and improving school climate. So some of the school outcomes from, in particular, Connecticut, but I will also talk about or share some from some of these expansion sites. So in Connecticut, they have implemented their school-based diversion initiative, SBDI, which is a school responder model, in 48 schools across 17 school districts, and they continue to expand to additional schools every year. They have decreased court referrals by 34%, and increased connection to services by 47%. So backing up, talking about that alternative response, these schools knew that if there was a problem, they could call the police and they would show up. In Connecticut, they have statewide mobile crisis response, 211. And so their school-based diversion initiative, their school responder model, is this relationship between schools and their school and the community mobile crisis. So they know when a kid is acting out that they can call mobile crisis, and mobile crisis will show up, conduct a screen, identify what the challenges might be, and then work with that youth and families to connect them to appropriate services. Nevada, which was really focused on, Nevada's a very rural community, and they focused on implementing a school responder model in a rural community and using telehealth, actually, to connect youth and families to services that were not available in the community. They were able to reduce their referrals to probation by 15%. Renew, which is a very, it's an overage, undercredit school in Louisiana. So very, very high risk, high need youth population. They were able to decrease their in-school suspensions and out-of-school suspensions by 49%. And Schenectady High School in New York was able to reduce their superintendent hearings, which is discipline, which very often led to expulsion and suspension, by 70%. So some pretty incredible outcomes. So what we're talking about here is this traditional model, right, is that there's a school infraction, and traditional school discipline would either lead to potentially an arrest, or depending on what the infraction was, or out-of-school suspension, in-school suspension, expulsion, what have you. And as we learned at the beginning, that leads to an increased likelihood of arrest or justice system contact. What the school responder model is not taking away the school discipline element. It's changing the framework. So it's providing that alternative response so that the behavior is viewed through the lens of undesirable, but perhaps normative, or undesirable, maybe not normative, but perhaps related to an underlying behavioral health condition where those needs are not being met, or potentially related to traumatic exposures and traumatic stress. And thinks about school discipline based on a graduated response model and restorative justice approaches. So thinking about the opportunities where we can help adolescents learn from that experience and be able to contribute, learn, and then be able to kind of reintegrate into the school community and be able to be a better school community member. If a youth does, in fact, have a behavioral health condition or trauma need that's unmet, that is leading to these behaviors, that would be identified through the screen. And then, a further assessment and then services and treatment would be provided to that youth and to their families. So what does it take to do this work? This is not specific to the school responder model. You need cross-systems collaboration. You need schools to be able to work with community-based behavioral health and law enforcement in particular, but justice system as well. And those folks really all need to have the same goals and same mission for how they're going to work together to help these children. You need to have that behavioral health response. Because if there's no behavioral health response, or if the behavioral health response is not timely, like in Connecticut, if there was not a 211 response, and the follow-up screening was going to take a week or two and the kid was in crisis, it's not going to work. You have to have that same timeliness of response so that the schools feel confident in their ability to be able to think about this differently and do something different. You need to have youth and families at the table for that particular youth and families, but also more broadly in terms of the policy and procedural aspects of this kind of work. And you need to have formal structures that facilitate cross-systems collaboration, so MOUs, things like that, but also formal structures that allow for these communities, these schools to do something different. If we think back to zero tolerance policies, those are very, very prescriptive in terms of what schools can or cannot do based on certain infractions. So just opening up the door a little bit and allowing schools to have a more therapeutic approach or an alternative response model to a lot of these behaviors. Not saying don't punish kids, don't hold them accountable, but think about it a little bit differently and really setting the framework for schools and community members to do something differently. So the cross-systems element is that you have to have school leadership, law enforcement, community behavioral health, family, and youth at the table. What we know is that not only school responder models will be more successful when you have youth and families at the table, but what we know about pretty much every evidence-based intervention for youth, juvenile offenders, and others is that if you don't have youth and families at the table, if they're not fully engaged, you're not going to be successful with those interventions. Family engagement is also critical in school settings. So what this is really demonstrating is that family engagement is the foundation for all of this other stuff, right? So consistent attendance, school readiness, all the way up to when we're talking about graduation and doing better in school, being more proficient, getting higher test scores. Family engagement is really critical because that demonstrates that the families are really going to be supportive and working as a team with the educators and with others. So when we're talking about implementing this behavioral health response, and we're in particular diversion, we want to think about it in terms of, we know that there are youth who are probably at high risk, right? Maybe youth who have a lot of systems contact, have experienced a lot of trauma. Those are not kids who we want to put into a diversion program, right? Those, for that type of school setting, if we're thinking about just high risk, high need populations in schools, that's when we want to think about things like trauma-informed schools. When we think about kids who might be escalating behavior and also high risk, that's when we want to think more about these kind of broad school-based mental health, broad school-based trauma-informed care, but the more universal interventions. This is the public health in me coming out. Universal, prevention. So when we're talking about diversion, though, we're talking about two key indicators. So there's the potential for behavioral health intervention. So that these are kids who are acting out where there's a potential for there being an unmet behavioral health need or an undermet behavioral health need. It could be that the kids are in treatment and maybe they need something else. And they're at risk of referral to the juvenile justice system. So this goes back to the chart that Ed was showing in terms of what happens from arrest on. We're talking about the kids who are right about to make it to that point of being arrested, where we want to think about how can these folks work together? How can schools, law enforcement, behavioral health work together to divert kids from that actual arrest incident? Behavioral health screening is a critical piece of all of this. Identification will begin with cross-systems training, so you need to have a workforce that is trained in recognizing signs and symptoms or potential signs and symptoms, or in the case of some of the schools that have implemented the school responder model, it's not even signs and symptoms, it's any behavioral health infraction that would lead to a discipline is the trigger for a behavioral health screen. So it isn't that non-clinicians have to potentially recognize signs and symptoms. It's just there was a behavior, something that we are potentially looking at discipline, and so we're going to conduct a behavioral health screen. Behavioral health screening is really, it's short, it's critical because it's really going to tell folks if there is a potential behavioral health condition. They're short. They can be administered by non-clinicians, so school staff, and there are a lot of validated instruments that can be implemented in school settings. These are not individualized, so it doesn't rely on people to really be clinicians or to know what the signs and symptoms are. They're easy to score. A lot of these tools are very, very brief. I mean, 5 to 8 to 10 questions. And they're targeted to critical issues. So there are trauma screens, there are broad behavioral health screens, but there's a range of tools that can be implemented in school settings. Here's a partial list. There are others as well, but this is just to show you that there are a lot of screens. These are actually all screens that have been implemented in a school responder model in schools. Once a screening is conducted, it's really, really important to have that behavioral health response. So for youth who do screen in, if the screening instrument indicates that there's a potential behavioral health condition, making sure that there's follow-up, that those youth are actually referred out for a full clinical assessment, and that any conditions that they've been identified, they're actually connected to services that are effective and that are appropriate for their condition, and that are available in the community. So creating those intentional pathways to service. The resource mapping piece is on here because you can create intentional pathways to services if the services exist in the community. So conducting this resource mapping or really identifying what services are available can help inform how you structure those intentional pathways to services. Services always exist or can, like in the example of Nevada, in a very rural community who didn't have those resources available. When a youth needed to see a child psychiatrist, their intentional pathway was to they used telemedicine for that. So there are, of course, opportunities for this, but making sure that the resources do exist in the community or that they're known and that there are intentional pathways to those services. A lot of this can be, you can leverage existing resources. These structures do exist, and a lot of what the school responder model work is about is not actually creating something new. Every school responder model looks a little different because it's structured around what exists in the community, what resources are available that can be leveraged, that can be expanded, that can be connected. So a lot of this is really around connecting existing resources, building up existing resources, and making it more accessible. So this can be, for example, looking at EPSDT, early and periodic screening, diagnostic and treatment. That's a tongue twister, which is why I always just say EPSDT. Entitlement through Medicaid. This can be looking at school-based health centers or mental health workers, community partnerships with behavioral health in schools. So if schools don't actually have the ability to provide behavioral health services, working with community partners to make sure that services can be accessible in the school building or youth and families can access those services out in the community. Mobile mental health crisis is incredible if that's available. And connecting partnerships with, again, behavioral health clinics. It was very helpful having conversations prior to today because I know that some of this work is actually going on already, and there might be some opportunities to think about ways to potentially use some of what's already happening to strengthen some of the school-based work. So at the beginning when I mentioned that some of the schools or some of the states that had really tried to expand the school responder model struggled. Some were very successful in implementing the full school responder model. Other states and communities really struggled with it. The single greatest barrier for every community that was not able to fully implement this work was the formal structures. And two things in terms of formal structures. It was, number one, interpretations of state policies around school discipline. And I say interpretation because what we have learned is that school districts interpret things differently. And in the same state, we would have school districts that would say, the policies say that we can't have an alternative response model for these 3 infractions. And the school district next door would say, well, maybe. And so what you would end up having is these formal structures that guide school discipline created a barrier to even have conversations around creating alternative response models. And this was the case in at least 3 of the states, that they really struggled around how to get around this, the formal structures. The second is around collaboration, so those formal relationships between the key players, so schools, law enforcement, and behavioral health in particular, where there were certain partners who really felt bound by what their role was. and they didn't feel like they could do something differently or didn't believe they should be doing anything differently. So if you don't have all of those folks on the same page, and a lot of that can be supported through MOUs or other kinds of standard agreements so that people feel, again, that they're allowed to think about working with kids in a different way, that it was really impossible to fully implement the school responder model. They were able to implement some aspects of it, but they were not able to fully implement. So, what can state policymakers do? Reduce barriers to creating alternative response models. Support cross-systems collaboration. The easiest way to do this is to support cross-systems training. And I know, again, some of this work is already happening, which is really exciting. But if you have all of those folks at the table, you have schools, law enforcement, community behavioral health at the table at the same training, and you're learning about adolescent development, adolescent mental health, it opens the door for there to be a shared understanding or shared vision for how this work could come about. Formalizing data and information sharing across systems. One of the states actually did something really, really interesting with their school responder model. So they were getting, they were struggling with the whole cross-systems collaboration piece. And what they ended up doing was funding. They got state support to fund, I can't remember how many exactly. It was like 4 or 5 pilot school responder model programs and an evaluation component as well, because they really wanted to understand, does this actually have an impact or the impact that we want it to have? And by working together, collecting data and sharing information, they were able to, over time, really come to consensus on this is a program that they wanted to continue. Sustain and expand existing resources, so really just leveraging what's already available. Not necessarily building something new unless it's something that really is necessary to support these youth and families, and leveraging as much as possible other programs, other resources that are out there to create those necessary resources if there is a gap that needs to be filled. And my quick summary, which is just that we know that many students have undiagnosed, untreated, and undertreated behavioral health conditions that affect their school performance and behavior. Traditional school discipline policies have the unintended consequences of leading to contact with the juvenile justice system. We know that there are alternatives that work if we create the structures and facilitate communities in doing this work. Behavioral health conditions are often not identified, and that youth and family need to be involved.